we'll start there and people can join as they come along if there's anyone that's yet to join. So thanks very much for joining this afternoon. So I'm Louise Hayes. I'm the Research Design Lead at the Specialist Centre for Public Health based at Newcastle University. So today's session is just a short session and very much an introductory session to quantitative and qualitative research methods. So if I can just move my slide on, this is always the first challenge with these things, isn't it? There we go. So the outline of this session, or the plan of what I hope to cover, is I'll give an overview of what we mean by quantitative and qualitative research or research approaches. We'll think a little bit about when you might want to use which of those types of approaches to do research, and talk about some of the more common methodological approaches that you'll come across, or the actual methods that you might use for both quantitative and qualitative research. So it's very much sort of introductory and very brief overview, and you could spend a whole hour or more on any one of these methods really exploring them. So this is really just a sort of taster, and we do plan to provide more detailed sessions around specific methods over the coming weeks and months, and any feedback you have on what type of methods you'd be most interested in hearing about would be really helpful, actually, so we can start to plan that programme out. Okay, so basically what we're talking about then are different approaches you can take to answering a research question, and the broad way that we categorise these approaches into quantitative methods, which are methods we would use when we're collecting and analysing numerical data, and usually then we're aiming to examine relationships between variables. So we want to measure how much of something there is, look at whether one thing is related to another, and we'll use statistics in order to help us to do that. And we talk about quantitative approaches as being objective, so we're trying to minimise the amount of bias that's in our study, or to account for that bias as much as we can when we do our analysis. And then qualitative approaches are quite different in that they are focused around using non-numerical data, so the collection and analysis of non-numerical data. And we use that to sort of understand people's thoughts and perceptions and motivations, and it's a much more subjective and interpretive type of approach to take. So I'll go on to talk about quantitative methods. I should have, as a bit of a disclaimer here, that I come very much from a quantitative background, so from an epidemiology by background, although I have done some qualitative. I'm by no means a qualitative expert, and I think that's probably borne out by the presentation. I think probably a little quant heavy. But I will start by talking about the quantitative methods. So as I sort of said previously, we use quantitative methods when we're asking questions, when we're answering questions about how much of something, or how many of something, or how often something happens. And we'll often want to explore whether there's a relationship between two sort of things that we can observe. So often, from my point of view as an epidemiologist, what we'll be looking at is whether there's an association between an outcome, so something like asthma, and an exposure, so exposure to some sort of risk factor like air pollution. And often what we'll be doing is testing something, and sometimes, although not always in quantitative research, we'll have a hypothesis or a theory that we're seeking to test and either prove or disprove. We can sort of subdivide quantitative methods into observational or experimental methods, and I'll go on to talk about each of these and give some examples of what we mean and specific methods, and also I've got some examples of studies that have used some but not all of these methods, mainly because of the constraints of time. I haven't got examples of every single one. So anyway, as I was saying, so we can classify the quantitative methodology into observational, by which we mean as the researcher, you're observing. So you're not controlling anything or modifying anything. There's no intervention on the part of the researcher. Or we can have experimental sort of approaches where the researcher is in control of the key sort of variables within the study. And so I'll give you some more information about sort of study types and try to illustrate what I mean by that over the next few slides. So these are some, but it's not an exhaustive list, but some of the most common observational designs that you might consider using or you're likely to come across if you're reading sort of reports of research studies. So I'm going to just talk about them very, very briefly today because we don't have a lot of time. But so the sort of most, I guess, smallest or simplest example of an observational design is the case report or case series. And these tend to be more clinical studies where it's an observation from a practitioner, often on one individual or a small group of individuals where something unusual has happened. And so they're the sort of very first design that just to sort of make you aware of that you've probably come across. There used to be, and probably still is, I must admit I've not looked for a long time, often in the BMJ, a case study report of a particular, a clinician would have observed something and be reporting that as an interesting observation, which might then spurn a whole, cascade of research to explore what has happened and develop a whole sort of theory and much more further research around that. And there's the sort of famous example is about HIV back in the 1980s. I won't go into that now, not relevant for today. Okay, so the next one that's on the slide here is the ecological study. And I'll say a little bit more about this one in a minute, but basically this is where we're looking at often using routine data that have been collected, which allows us to look on the population levels and not looking at individuals within a population, but looking at a sort of aggregate value for a whole population and to identify whether a relationship or an association exists between some sort of risk factor or exposure and some sort of outcome, so maybe a disease or some condition. The next one I've got up there on the slide is the cross-sectional study, which I think we'll all be really familiar with. This is where we do sort of survey type research, where we would often send out electronically, most usually these days, a questionnaire survey that we'd ask people to complete, and we'd ask for information on two variables, so things that we think are risk factors or exposures, and the outcome at the same time. So we often talk about them being a snapshot in time, and so we might ask about things like housing conditions and respiratory illness because we're interested in those and whether there's any association there. And then we sort of get to more, slightly more complicated, therefore more costly, resource-intensive type designs. So the case control study, which is where you identify a group of people with a condition that you're interested in, and a group without the condition, and you want them to be as similar in all other respects as possible, and then you'll look for differences in things that they've been exposed to see whether you can identify anything that seems to be associated with having the condition that you're interested in. And the sort of classic example of this is in public health. Well, there are several, but smoking was one actually, but the other one that's often given is if you imagine being at an event like a wedding, and there's an outbreak of food poisoning, and you can get the guests from your wedding and identify the group that got food poisoning and the group that didn't, and then explore what they ate from the buffet to try and pinpoint what was the exposure, so the food that they ate from the buffet that was associated with the food poisoning. And then we're on to the cohort study, and then this is usually more lengthy and expensive and difficult to run than a case control study or a cross-sectional study. And this is where typically we'd recruit people, usually follow them up prospectively, so over time, sometimes retrospectively, but on the whole, cohort studies are prospective. And we'll identify a group of people who don't have the outcome that we're interested in at the outset, and then we'll follow them up over time and see who develops the outcome and who doesn't, and then compare the risk factors between them. And then the last example that I've put up on the slide here is the natural experiment. And these are often used where there's something like a policy change that's implemented, and there's an opportunity to assess the impact of that change in policy, because people are sort of naturally exposed to the policy by virtue of where they live or time, if it's implemented at different times and so on. So I'm going to say a little bit more about a few of those studies, not all of them. You'll probably be pleased to hear because there's quite a lot here. But I'm just going to say a little bit more about ecological studies, cohort studies and natural experiments over the next few slides. So starting with the ecological study, so just to try and give you an example of what we mean by that. So I think I said previously, but the sort of key feature of the ecological study design is that the unit of observation, so the thing that we're analysing, is not one individual, it's an entire group or an entire population. And I've got an illustration on the next slide to try and make that clearer. But what we're doing is looking at the correlation or the relationship or association between the average exposure in the population, so the average, what the average receipt of a certain risk factor is, with how common the outcome is in the whole population, and often that will be a disease. So on this next slide, hopefully to make that a little bit clearer, although it's quite a blurry slide, now we'll look at it a bit bigger. But so this is an example which is an old one, but these are data that were published some time ago. But this is looking at average meat consumption in a whole country, so many people on the sort of the horizontal axis. So this is per capita consumption of meat in grams. So this is taking the whole of the meat consumption in the country and dividing it by the number in the population. And then on the y-axis, on the upright axis, this is the average is the incidence of colon cancer. So this allows you to calculate a correlation between the average meat consumption per person in the population and colon cancer. So it gives you an indication of if there's a relationship between meat consumption and colon cancer in this case, which, as you can see from the slide, each of these dots with their little, the sort of a shortened form of the country name on, is demonstrating there's quite a clear linear relationship. So as meat consumption increases, so does incidence of colon cancer. So this sort of is a useful way of getting an indication that there might be something going on, but we always need to be mindful of something called ecological fallacy. And by this we mean we're making inferences, so drawing conclusions about individuals from an aggregate statistic. So what it really means is we're assuming that the relationships that we see at that group level apply to individuals. And so if we think about that example I just showed, we're concluding that meat eating is associated with colon cancer, but what we don't actually know from looking at that graph is whether the people that ate the meat or who ate the most meat were the ones that got colon cancer. And that's called ecological fallacy. So that's just something to be aware of with that type of design. But it can be really useful, and you can often make use of existing data that's been collected and is available to make those sort of, to look at those sort of relationships at that population level. So I'll just say, I'm just mindful of the time, so I'll speed on a little bit, but just to say a little bit more about cohort studies. So these are, as I said, we recruit a population at the start without the condition that we're interested in, and then usually we'll follow them up over time, so prospectively. And we'll usually look for a group that's exposed to the risk factor that we're interested in, and a group that's not. We'll want some variability in who's been exposed and not. And then we'll look at how frequently our outcome that we're interested in occurs in the group that's exposed to the risk factor compared to those that's not exposed. And this is just a sort of schematic of how that study is designed. So we start with the whole population, the big purple circle. We'll identify our cohort, so people without the outcome we're interested in. So if it was asthma, to use our previous example, and then we'd look at whether or not they were exposed to the risk factor that we think is important. So is that air pollution, say, or high levels of air pollution, and then we'll follow them over time and assess them to see whether or not they develop our outcome. So, and some will develop asthma and some won't. And then we can do some analysis around that to see to what extent that exposure is associated with the outcome. A nice example of a cohort study is the Bourne and Bradford study, which I imagine many of you will know of, and I was quite shocked to find when I just looked this up, it's almost 20 years old, so I think of it as relatively new, but established back in 2007. And that they recruited women during pregnancy and their families and measured all sorts of things to get information on things, genetics, behaviours, environmental things and social things. And there's a big sample at the outset. Over 12,000 women were involved, and then they were followed up regularly and are still being followed up to collect data that enables the researchers to generate findings that inform what factors from all this sort of soup of genetic, behavioural, environmental and social factors they can tease out as being related to subsequent health problems or health issues. And it's now been expanded, so there are now 3 cohorts at least that are all being tracked through the Bourne and Bradford study, and there's loads more information about that and the sort of really interesting findings on the website, and the links there on the slide. We will circulate the slides later. So then I'll just say a little bit about natural experiments. These are what I was saying before, where they're often used for evaluating policy change. And this is a quote from Peter Craig's paper from a few years ago, where these are where there are events outside the control of the researchers that divide populations into exposed and unexposed groups. So it's not an experiment in the way that a trial would be, where we're allocating people to receive or not receive something. This happens because of a natural occurring thing or a policy change, something that's implemented. So, for example, it's when a policy is implemented in one area but not in neighbour areas, we're able to identify a population where the exposure has been received and one where it hasn't. And one of the sort of things to be aware of here is about data quality, which is often the case if we're relying on retrospective data that's been routinely collected with no control over that data. So there might be issues around how complete it is, what the quality is like, whether it's really fit for purpose. So that's just something to be aware of there. And an example of a natural experiment, which is relatively recent and received quite a lot of publicity, was the introduction of minimum unit pricing for alcohol in Scotland, which was introduced in 2018 and not in England. So in this study, the researchers aimed to look at the impact of the introduction of the MUP on deaths and hospitalizations. So they were able to do that by using some fancy statistical techniques, really, but basically because this wasn't introduced in England, they could compare the trends in admissions and deaths in Scotland, where it was implemented, to those in England, and work out how many deaths and hospital admissions were attributable to introducing the minimum unit pricing on alcohol. And their conclusion was that it equated to around 156 deaths per year being saved in Scotland with the introduction of that minimum unit pricing. I shall move on quickly because I'm conscious we've got only 10 minutes left. So in terms of those were the observational designs. I also said we have experimental study designs. So I think I probably won't go through these in so much detail given the time, but there are 3 sort of main experimental study designs you're likely to come across. There's the randomised control trial, RCT, which I'd imagine everyone's familiar with. This is like traditionally what's used in clinical medicine where we're testing a drug, for example, but also equally could be used in any sort of lifestyle type intervention, behavioural intervention. This usually in a sort of standard RCT, individuals will be randomly allocated to either get the intervention or not, and then we'll compare their outcomes to see whether the intervention seems to have been effective or not. Sort of related to that is a cluster RCT, where people are allocated in clusters or groups rather than as individuals, and that's usually done when it's not sensible to randomise people individually. So, for example, if it was something like changing social workers' practice, it wouldn't really be practical to expect a social worker to have individuals randomised, so that sometimes they gave them the new practice and sometimes they received the old type of practice. So you'd tend to have your one social worker there, all their patients would become one cluster and they'd all get the intervention and another one would not get the intervention. And the final one is the step-wedged cluster RCT or step-wedge design, not always randomised, but the sort of more robust ones are. And this is when Similarly, people are randomised as a cluster, but everybody eventually receives the intervention. So you start and your sort of initial group becomes the control for the first group that received the intervention, and gradually you build more and more people receive the intervention in a cluster, and you retain one group as a comparator group right till the end, and then they usually get the intervention right at the end. So I have got some examples of these on the slide, which I shall whiz through in the interest of time, but this one was an example of a sort of standard RCT where individuals were randomly assigned to either get advice on welfare rights or not from their GP. And they looked at the impact of this on health-related quality of life. I won't say much more about that other than it's there and you can have a look if you're interested. This one is an example of a cluster randomised control trial where the cluster is a school here. So each schools were randomly allocated to either deliver a dance intervention to girls or not. And then lastly, this is a sort of more clinical example, but of a stepped wedge design where hospital wards were randomised to receive a wearable device that was intended to improve hand hygiene compliance. And again, I won't say any more about that just now because I'm mindful of the time and we need to quickly cover some of the qualitative designs as well. So yeah, so when do we use qualitative methods? So I've covered off very briefly or some of the most common quantitative methods, but we don't always just want to know how much or whether there's a relationship statistically between two things. Sometimes we want to understand more about the how and the why. And so we talk about qualitative research as trying to help us to understand much more the social world and why people hold certain opinions and motivations and how they impact on their behaviour. And as with quantitative, as I'm sure you know, there's lots of different methods that are available to use that would meet the sort of criteria of being a qualitative method. So some of the key ones I've put on the slide here, which I'd imagine most people have some experience of, but the sort of, and again, I'll just go through a couple of them in a bit more detail, but the sort of key methods that we usually think of are semi-structured interviews where the researcher has some key areas that they want to cover during an interview, but they'll be flexible in terms of how they ask the questions and let the participant lead to some extent. It will depend. They'll make sure they cover all the material they want to, but it won't be in necessarily a sort of predetermined order. It'll be more like a conversation. And then unstructured interviews are then even more open-ended. So the researcher tries to come to that with sort of open mind, no preconceptions or topic guide that's going to guide the conversation, but more like inviting their participants to tell them about their experiences and to tell them in a sort of a story type of way. Observation, so by this we mean sort of direct observation where researchers observe a situation and record what's happened. An example of that I've been involved in a long time ago now was observing children at play and just literally watching them and recording what they did to get an indicator of physical activity during the school day. This was. And then focus groups, which I think we're probably all most familiar with, where we have a small group, usually anything between 6 and I guess up to 20, but generally more like 6 to 10 people in a group, where they'll be moderated by the researcher or a facilitator to discuss a specific topic. And we might also use some sort of log or diary where we ask people to record aspects of the life, which then are analysed by the researcher. And again, I've got a couple of examples of these, which I shall whiz through again, but there are the links on the slides if you wanted to look in more detail, but it's really just to give you an idea of where they've been used. So this one was about engaging migrants in infectious disease screening. And so the researchers used face-to-face interviews with community healthcare leads in order to find out what their views were about what would help to facilitate by making access to infectious disease screening easier for migrants and reduce stigma associated with attending. And so they came up with this idea that if it was included in a general health checkup, that would help to do that. So very quickly, that's that one. And focus groups, this was an example that I found, which is about why people choose to use urban green spaces or not. And again, this was this sort of informed a subsequent in-depth interview study, but initially the researchers conducted focus groups with quite large groups, actually up to 20 people, where they identified the areas that they wanted to explore in more depth, which I've listed on the slide. I won't go through them now because I'm mindful we've got 3 minutes left. So very briefly, comparing quantitative and qualitative approaches, and again, I won't read through all that now. It's just summarising what I've already said in terms of what the purpose, the participants, the process, the type of data you would get, and the sort of analysis you'd get, and the sort of resulting findings, what form they would take. So in terms of choosing the right approach, really, I mean, this is a bit of a cop-out, but there's no sort of rule about this. And really, the approach you take has to fit the intended purpose of the research. So this will be guided by largely the question. So is it a question of, is alcohol consumption decreasing in the northeast of England? Or is it a question of why people drinking less or drinking more in the northeast of England? And that would guide whether or not the most appropriate method is quantitative or qualitative. And it's also driven by the researchers' beliefs, values and skills. And also it can just often be partly influenced by practicality, so what resources available. And I'm going to finish very quickly by saying often what happens is we don't actually use only one approach. So often the best approach is to use a combination of quantitative and qualitative approaches. And so there's a nice example here of an ongoing study, which again you can click through to just read more about. But this is looking at what the impact of the universal credit implementation has been or is continuing to be. So this study is used surveys. So quantitative approach to look at mental health in households receiving universal credit compared to legacy benefits, which are the benefits which universal credit replaces. And another survey to look at features of the system that present difficulties to the claimant. So that's done in a quantitative way. But then they're also planning to go on to do interviews, so qualitative interviews with both claimants and staff, to explore ways in which the experience of claiming those benefits impacts on the mental health. And that's like, a really nice approach where you get the sort of quantitative, which tells us sort of what's happening, but then the qualitative to explore maybe why that's happening as well. So with like 30 seconds to go, I did have a slide for questions, but unless anyone's got one very burning question in the last 30 seconds, I think I'm happy to receive any questions or queries by email after this session. But and I've just seen there is one question about the slides and the recording, and they will indeed be made available after the meeting. We'll make both of those available to everybody that's recorded. That's registered. And I think in the nick of time, I'm going to just put up my contact slide, and just to say, but we really welcome any feedback and suggestions for future seminars and webinars and so on. And if you've got any queries at all, do please get in touch either directly with me or via our generic email or inquiry form, and the links are all on the slide there. Thank you very much for your attention. Apologies, it was a little bit of a whistle-stop tour, as they say, and look forward to seeing you again. Bye for now.